very innovative physical therapist. And we recently had a consultation. She was going to try to be here today, but she had too many conflicts. But she says, I'm getting so much change in his tone, his trunk flexors and everything. She's got him in the water. And she's actually getting him standing upright in the water, and he's holding his balance. So the big challenge now with Jason is the osteoporosis, because there's no weight bearing, and we're starting to lose that. So if we don't get this muscle tone, remember what happened earlier? He had the fracture because somebody muscled it with that much muscle tone. If we don't get his muscle tone down, and he's getting osteoporosis, we get some complications that we have to think about.
Oh, that's what's going to happen is movement. It's going to start getting movement. As soon as you get that blood supply to the area. Once that happens, the body starts toning itself out.
Yeah, he's doing it. So it's happening. The autonomic nervous system's kicking in. His brain is starting to function differently.
Yeah. Some of like what you and Jane did is the fact that you have him doing movement while you do that, the areas of the neck or spine.
What we did is we did profound, huge amounts of photon stimulation to the brain as he was doing it, and that was a really good insight.
Well, that's one of the things Gonzalez does a lot is stimulating cerebellum while you do, like if you're treating cranial nerves, you get them to watch. But the key is you want them to actively do speak, stick their tongue out while you're treating.
Test and pre-test.
It's like it engages the...
Right. You do this a test and pre-test. But you could see also he'd started off when we were examining him where he couldn't get his tongue out at all. And then later on he was able to do that with the speech. You asked him to talk, he didn't get any affect.
This is all new to me when I'm doing, but I find the same thing as movement. The more movement gets to an area, the faster things seem to go.
Yeah, I think it's a key. It's a key to these situations. And even if you have to do the movement for them. When I've worked with Jason, I treat him and then I move it, and treat him and then I move it, and then he moves it. It's there.
So when I start with you, they can't even get their arm up, so you just pick it up from them all and say, oh, should I do that now?
Yes.
So maybe something against resistance.
I think it's about firing the proprioceptors.
Understood too.
And once you get the proprioceptors working, then you get a whole part of the brain stimulated. So there's so much to think about when you start seeing these kinds of changes this rapidly, and then wanting to go the distance and say, okay, we're doing it this fast, let's do it faster. You know, how much faster can we go?
That's it. Can you say, oh, do you think you're doing?
Yeah, we want to do it faster, better, and we want this to be, you know, the best because we've lost a lot of time, and we got to catch up to 10 years here, and we've got the expectations that we will. And there's a lot of family support there.
Sure.
So, you know, there's no negative scripting of I can't, you're not gonna, and I can't. It's always, we're gonna do it, it's gonna happen. And it's happening. But believe me, not without a laser. It wouldn't have happened without a laser.
Could you get him in the hyperbaric chamber?
I can't because we can't physically get him in and out. So, and if it was, actually I brought that into the practice specifically for Jason, hoping that we'd be able to get him in the chamber. But one of the things we haven't added to it is we could do a routine of adding oxygen, just, you know, with a nasal cannula. And I think that would be a really good thing to do next, is try to get him in here earlier, have him sit for about 15 minutes, maybe even a half hour if possible, just with the extra oxygen and see where we go with that. Because hypoxia is a key to it, and you see the tremendous change when you get that circulation with the stellate ganglia, but boy, is that an important area to stimulate. So, wow, we did good with the nystagmus too today. I mean, that was just a wonderful session. Really a wonderful, profound session. And every time we see something extra and more and extra and more. And, you know, it's just really about brainstorming, okay, what's next? Where else can we stimulate? Where else can we go? How else can we do it differently? I think it would be really cool to be able to treat him with the laser before he gets into the water, where he's going to be able to really have some proprioceptive firing with standing in the water and getting stimulation there. So I'm hoping at some point to hook up with his physical therapist and join her in a session to do that.
Well, what can I say? We're so well. Did you keep clearing things?
Bye-bye.
Bye-bye.
Thank you. See you soon.
Are you serving dinner?
I know, eh?
I hope so. I came here for dinner.
That's it.
Bye, everybody.
Bye.
Is he sitting any different? What's going on?
Yeah.
Up straight more?
Good. He had more tone.
It looked like it was up straighter too.
Yeah, all right, I wanted to introduce you to Catherine Dahl, and as I was saying earlier, she's a wonderful professional artist and has created some beautiful artwork, is very well known in the field of art. And Catherine, would you like to share what happened initially in terms of your illness?
In 1988, I'll start from there.
That's good.
Because I feel that was the initial impact and altering force. I was in a car accident and had a traumatic brain injury, which left me a bit of a bozo for a number of years, and of course, maybe still. And Heather was one of the first people when it was finally diagnosed or when we realized that there may be things to do that helped me with craniosacral work. And how would you... But after that accident, there isn't really anything that you can do particularly for a head injury. There wasn't at that time, except go to rehabilitation and do things which you can't remember you ever did 5 minutes afterwards, so it was not too valuable. But I think in terms of this setting, that for me was a point which changed my physical arrangement. I felt that it cast a kind of skewing of my body parts in a way that had them not working too effectively. So I developed, I used to walk 4 or 5 miles every day in the park, and I went through a period where I began to notice that I was incrementally slowing down, but because I wasn't functioning very well, it didn't register as something that needed to be addressed. And I would go, oh, today I don't seem to be able to lift my leg over the curb. And then that progressed, and I was unable to move at all. I was just like stone. I couldn't turn over, there wasn't anything I could do, and I'd always been a ferociously independent and capable individual. So here I was. So the answer was, since it looked as though I was going to die, to put me on chemotherapy and lots of prednisone and any other cocktail that could be mixed. So that was like, the phenomenon was interesting because at the same time I went on that, I went to a 2-week, a meditation course, which I'd been very involved in. And so I got a lot of healing work at the same time, but probably it was that combination of chemotherapy and healing was like flipping a switch. And I went from being this block of stone to just very in slow motion the other direction, coming back to full mobility. So that was an interesting phenomenon. But then they determined that I had a condition called Sjogren's syndrome, and so it was eating my brain. So I spent a lot of years on many, many drugs, and have now spent many, many years trying to counteract what I feel were the probable consequences of those drugs. And so all the time that I've been taking things, I've been working to clear them out. So now more recently to populate, I did want to say that I felt one of the most important exponential shifts took place in my healing when I lived in Hawaii for a period of time, and I swam a great deal. I'm an ardent ocean big wave swimmer, and I had the opportunity to swim with the dolphins there. And on one particular encounter, the first one that I had, I'd never been a flipper fan. I really didn't care particularly. They're they're out there. But I went with a friend who had always wanted to see the dolphins. And so I went along with her, and we were way out, and they didn't appear to be around, and we waited and waited, and finally were ready to go back in, and suddenly, of course, there they were. And they surrounded us, and she burst into tears, and I thought, oh, how sweet. And they all gathered around her, and they kind of went swimming off together. And so I was watching with my mask and snorkel, and was just touched deeply, but I took a breath and I went and looked straight down, and there beneath me were a group of dolphins which were creating a formation, rather, I would say, a sign of the cross, in that it was this, echoing my position in the water. So there I was hanging there, they were hanging there, 2 or 3 in each position. Now they're lively creatures. I mean, they don't just
make
sit
formations.
No, they don't, not just like that and hang
You
there.
were doing synchronized
So
swimming.
we had this, so it was whatever it was that took place, I felt had this remarkable effect on me. And I have a book that I was working on during that period because it was a particularly trying one. I'd gone to Maui to help with my healing and just in a new environment kind of way. And while I was there, I was in a home supply store and was standing waiting for my friend, and someone walked by with a 2x4, and I got the classic joke, I got hit in the head with a 2x4, which was a real exacerbation of my condition. So it was a very, very difficult time, and I began recording that in my drawing and writing. And it's very interesting to see because it was all lamentations and despair and but it was really rather good work, but it was in that vein. And then the dolphins came, and you can just see, I mean, everything changed. It was amazing. So I went all over the world looking for where I could swim with dolphins. And I think it gave me, it instilled a kind of passion in me that I hadn't experienced for years since that accident. So that was a critical form of healing for me. I'd recommend to anyone. And then since I've been back here this time, because I was going to eventually move permanently to Hawaii, but I came back to Atlanta, and I'm not sure how I stumbled in the way, but I began working some more on what I could do to address the physical conditions that continued in my body with this kind of arthritis, rheumatoid arthritis, all of these things that had come up. So I've done every kind of healing modality and a lot of my own healing work that I think comes naturally through meditation. And so now I've reconvened with Heather, and I've been doing the hyperbaric therapy and the laser work, because my knuckles have become quite deformed, or increasingly, and at the same time I've wanted so much to discontinue the use of some of the drugs that I've been on, which allowed the deformity to be curbed. But as soon as I go off, then I get all these. So it was, do I sacrifice my liver and all my other organs for the sake of a nice looking hand? So now I'm working with someone who feels that, speaking of bacteria, that the RA may be caused by bacteria.
Mm-hmm.
And so I would be interested in any of your ideas on that. and I've been coming to work with Heather with the laser, and I feel there's been a significant change in what's taken place, and it hasn't been that long a period of time
It's not.
with this big honker that you have.
Yeah, I've got a new strong Q1000. And what I want to tell you about the change here is this knuckle used to be huge. The ulnar deviation has stopped. She was starting the classic. It was going boink. We've stopped it. She's able to keep her hands straight. But in terms of carpal tunnel, median nerve, you get that with an involvement with rheumatoid arthritis. So what we were seeing was a complete atrophy here of the thenar eminence. There was just nothing. It was perfectly flat. And now look, she's got some tone and she's got some tissue coming back.
It was very fascinating because when you were working on it that day and suddenly this just kind of plumped up.
It was like we fed him spinach.
It was like a battleship.
Yeah. And one of the other things about Catherine's history that's significant is that she was an Olympic contender in diving. And so she's quite a swimmer, quite a diver. But you haven't been diving.
On my 60th birthday, having just had my 65th, I went skydiving. And
Not that kind of diving.
well, paragliding.
Paragliding.
And I did dive. I went in Maui. There's a place called the Seven Pools, and they're very high cliffs. And I stood up there, and I used to be a tower diver, but I haven't done it for a number of years. Well, there are all these little kids diving off these high places, and you can do some serious damage. And so there I was trying to say, well, if you do, I was trying to show them how to grasp their hands and what to do in the under the water to keep them just
Same.
rearranging themselves. And they would look at me, not really pay a lot of attention for some reason. So that was all right. I went away and left them alone. But later I was standing up on one of these cliffs, and it just brought everything back. And it was like I couldn't contain myself, so I dived off. And it was probably 30 feet. And what was fun is that it was a really good dive, and a friend of mine was there with a digital camera and got 5 shots on the way down. So I felt it was mine.
Wasn't it?
She ran her little finger down her body, and then she'd say, well, what about this? What about that? I said, that happened back then. And yeah, it was just bingo, bingo, bingo.
Chapman points.
Totally.
Yeah, what we did is we traced injuries that she had never brought up in her history with me. And I've been treating Catherine on and off when she's been in town for many years.
She was my savior after my accident. She was one of the first people who understood what it was to have a head injury. Because nobody really knows.
That's right. You're welcome. You're welcome. It's very hard when there's cognitive impairment. There's just no question about it. And when you're a high-functioning individual and you know you're having cognitive impairment and you have the self-awareness of that slipping away, it's very difficult. And then when you're a wonderful creative person and you lose that, it's twice as difficult. But the miraculous part of it is watching people be able to come out of it. And the more skills that we have and the more tools that we have for helping people, assisting people in that, I think the greater impact we're going to have on the universe overall. My cranial patients, my head injured patients have taught me more than any textbook could ever teach me as a physician. And so thank you for being there for me, and thank you for volunteering for this.
Well, I'd do anything for you.
No, you're sweet. Well, listen, what are you feeling today? Where are you hurting? I see you moving your hands around a lot.
My hands off here, always this area specifically, and these fingers.
Okay.
It's primarily now, it's interesting the way it changes from right to left hand, and from wrist to fingers. It's odd the way in which moves around. So today it's primarily this area and this finger.
And
They're
that
kind of
finger.
crunchy.
They're crunchy. See a slipping of the tendons with them bumping included in hands. Okay, so should we just go ahead and do the laser to take away the pain?
You just take over the show.
Okay, do you want to take away the pain or do you want to make a change in the joint overall?
Well, I'll follow your recommendation.
Okay, let's see what we can do then.
I'm used to pain, so I'm more interested in
Making a
in
change. Look
changing.
at the extension that we got on that wrist. We didn't have any of that.
I couldn't, yeah.
There's no question that wasn't going to happen. And come in here. So that's fabulous movements on your wrist, Catherine. Oh my God.
Yeah, my mother had hands that went like this, and then her knuckles lost.
Off
From the
of
first
that.
digit went off
And
again.
you pick things up like this because you can't open and close your hand, but you're not going to do that because number one, you're not going to have hands like your mother. Look, we can straighten that finger. That was not happening earlier. That's a straight finger and the joint's gone down. Hey, this is good. We're making progress. Spread your fingers out here. Let's do a test. Push. Push. Oop, weakness there. Push. Turn your hand over. Let's press through opponent's pulses. Keep that strong hold. You'll pull it apart, you press. Ready? Push. Tighten it like you're pinching.
I am.
Turn it over. Let's see the other side. Press. Push. And nothing there with the thumb. Okay, so I'm sure you're aware of that. I'm sorry, guys. She just flipped that wrist over, and I have to report she adjusted the elbow in that motion. Okay, so what we have from that is a lot of ligamentous laxity. She slips in and out of adjustments. Okay, so what I think that would be a good idea would be to irradiate the area clearly. Any other ideas, guys? Just give me your input.
I'd say the scalings.
Yeah.
Scalings?
Yeah.
Sacral plexus, then through here.
Kind of.
Okay. How about up through the armpit?
Yeah,
Ah,
absolutely.
we got a good
Super,
shot.
super.
Good shot there.
Go for it.
Okay, now Sjogren's disease impacting the brain. Where else do we want to go?
Vagus nerve.
Vagus nerve with stellate ganglion.
Favorite.
Increase the regional cerebral blood flow at the stellate ganglion always. We're going to start here, Catherine.
I'm gonna.
How's that for a beginning
Well,
of
you'll-
fixing this?
Small vessel disease in my brain.
You have a small vessel disease in your brain. What
Or
are they?
small vessel condition.
Small
That
vessel.
was early.
And that was early on. And what was that doing?
Well, that was just a test result.
That's what you
Well,
had.
it no doubt affected my, well,
Circulation.
I don't know actually, because that was a time when I was pretty incapable of knowing much of anything. See, I'm miraculous now. I mean, I'm just a Mensa person compared to where I was. So, if you don't quit, they're good rewards.
You know our motto, never give up, never surrender, right?
Well, I was really served by the fact that I had a father who was a real scholar and intellectual, and he shared with me many of the quotes that had been meaningful to him through his life, and one of them was, we would walk along, my favorite memories is walking along as a very young child on our way through the snow in Nebraska, and I would be all bundled and covered and mittened and muffed, and we would walk along, and I could hardly bend my arm, but we would say, one who never turned his back but marched breast forward. And so I think that has been a guiding light in all of my life, and it served me well.
Can you catch the other ear for me? There we go. Oops, sorry. Feel anything as we do this?
I have an awareness of this ear.
And she keeps trying to lean into it.
Hey,
She
yeah,
wants
it
to
feels
move.
good.
Yeah.
I'm going to the light.
Phototropism there.
I think I just sprouted.
So actually, one of the chemical effects is to increase the heme, and it's a photochemical effect, just like
What do you mean by the heme?
photosynthesis. Well, it improves the production of red blood cells. Laser therapy, remember? We talked about porphyrins, and we talked about P450. These are chromophores. These are light-sensitive enzymes. When you stimulate the light-sensitive enzymes, they go to work. And one of the things that they do is they take out the garbage, so you detoxify the body, and they make new blood cells. They stimulate the creation of new nerve endings, and from there all else follows. There's many other things that you are doing with laser therapy. Besides, in this case, we're really not interested in laying down collagen. We would like to get that blood circulation going. Now, when we get to working in the hands, we're going to hope for laying down collagen. Because when you have issues with changes, oh, by the way, there's DNA changes and RNA changes with the laser also. So when you have changes in the joints, what you want to do with arthritic or spondylosis or any of those conditions, you want to go ahead and try to build up the collagen in the joints. So, there you go, Catherine.
Yeah, boy, the breath is coming back beautiful.
Oh, big cheeks there.
Maybe like this back. Go ahead.
Huh?
Did I take a shoot?
No, you're having fun with it. Check out her liver. She had a lot of stuff with that liver. It's feeling good,
I
isn't it?
have one thing I found out this last year that kept me in Atlanta was that I have a mass on my liver. It's benign, but it's a large hemangioma. And so we didn't know until lots of nuclear medicine tests let me know. And I don't know that that would be a result of anything that had to do with medications or physical conditions. It might just be an existing property.
Okay. So working with Catherine is important to work with her liver as well.
You're going to take that back to your hand?
Yeah. We have your hand and we'll start working on that.
I could feel that. It was as though there was an energy in that, and
You can sense it.
Something you
I'm
felt.
used to, yeah,
Mm-hmm.
respond well to good energy.
Can you squeeze my hand for me? That's as hard as you can squeeze? That's it? Okay.
You're scared, aren't you?
I'm scared. Alright, let's have you relax. How about the other hand? Can you squeeze my hand here? Now I can feel that.
Yeah.
That's, wow! Now you're gonna win the contest. Let's fix this so you got a match set, okay?
Oh.
We're gonna go right for the median nerve here. And what I'd like for you to see is if we get some pumping mechanism going on here, if we get some innervation going, and we bring up that tone.
So that's your goal.
Yeah, if we can bring up a little more tone in here, and it's starting. See that that depression?
Yeah.
It was all like that.
The whole
Wow.
thenar
There
eminence
was
was
no
depressed.
pump.
There was
No pump there.
no
Fleshy.
pump. It's popped up.
It is.
Yeah, see
Yeah,
it?
it's starting to.
So we're gonna improve blood flow.
Oh my.
And with the blood flow,
Beautiful.
and that's cool. And with improved blood flow, we also get nerve function. Right? See it coming?
Oh yeah.
Just like you took a little balloon and went whoop. So we're finally getting blood flow through that hand, through the wrist, the arthritic wrist.
I fell a lot on my hands, really crashing falls after my head injury. My balance was
Yeah, of
not
course.
good. And so I think that certainly affected my wrists. So it's amazing that they're
One of my questions about Catherine's situation is, are we possibly seeing impact of Lyme disease as well? Is it possible? Because you were raised in the country.
no.
Never spent time in the country. Do you remember what we talked
Not
about?
as a-
Where are you raised, Catherine?
in Nebraska, but in a small town. I had, there was one time when I had but it was because I was in the mountains, and it was after being in the mountains and in the Smoky Mountains. And I had one of those classic big bullseyes on my bullseye.
Bullseye on your bullseye. I'm just gonna do the break.
But I've never tested by the usual methods for Lyme.
See this side coming up? Oh, you know, there's some good tissue resistance now.
And where you're putting it now,
It's on the brachial plexus. So every single nerve to the arm is being stimulated. And all I did is I lifted it up and it's shining under the armpit through her clothes. Okay.
I was just thinking of one single muscle because of what I do.
Oh yeah.
I wasn't even thinking of
Well, you catch the
the whole
entire
thing.
nerve plexus.
Oh,
from
man.
it. Isn't that cool?
Yes,
Oh, hands on your
ma'am.
hand changing. Let me see. What do we
Wow.
see in here? Pumping up. You're pumped. Your Arnold would love you.
Could you supply in some other places?
What was that? What was
Like
your
a room. Maybe I can leave the room if you want to.
Maybe another application for this.
I'm sorry, but there is research in that field.
Yeah,
So
I'm sure
they
there is.
haven't missed that in Europe.
Oh,
They're doing research in that field, actually.
And I'm sure they are in Europe.
Yeah. You are funny. Look at that.
There's more color, it looks lighter, the younger tissue.
Yeah, look here.
She likes that word, right?
well,
Let's
I
go
like the
behind.
idea of, what that means I have more to go.
Does anybody create like a laser sauna? You sort of blast from
Yeah,
all
just-
directions?
there's lasers which you lay under,
Right.
and then they do their thing.
Oh,
About $65,000.
worth of. Yeah. Okay, well.
Now, let me tell you what you can do with your little tiny light pen. You can fix crooked fingers. Oop, can't have his hands moving. You can straighten crooked fingers real fast.
Well, I got two of them.
You got two crooked fingers?
Oh, yeah.
Oh,
Oh,
we're
hey.
getting crooked fingers.
Cute.
You're next.
Those are my
Yeah.
cute crooked fingers. Had
So the
them all my
medium-
life.
Yeah, we'll see what we can do to fix them. The median nerve comes in and will innervate this whole area in these fingers here in the palm. Look at that palm. She's able to do this. Look how flat she's getting that hand.
I had to stop doing yoga because I couldn't adapt those.
We might get you back to yoga. So what we did here, we opened this up, but we've got some swelling, so now we get a place for that to go. Once we get rid of it, we get a way for it to drain. So we'll come to the back here because we've got swelling in here, which you can't see, but if you palpate it, there's a little knot of edema there. So we'll see if we can break that down. And then we'll go to this knuckle and see how much more of a change we can make. That knuckle was huge. Huge the other day, remember? And you were despairing and didn't think we could do anything for it. And look, we've done it. Yeah, gotta change your mindset. This is quantum thinking now.
Oh, a lot of my art
It's
is quantum physics.
I know.
Yeah. So and I think that makes a difference, absolutely, how we regard the possibilities.
That's right.
Yeah, if you don't entertain the fact that it can happen, when it does
I
happen,
mean,
you
that's
can't
what's kept
acknowledge
me
it.
going. It's just
Look.
The color.
Look, no, it's not the color. Look. Boop, boop, boop. These are coming up.
Oh, is it overall on her hand or the hand colors?
Yeah, look, it's coming up. Look here. What do we have? Improvement of circulation. It's just whoosh, going right there. Look how much has come up. It's really amazing.
Would that pen thing you used on Jason do anything here with Kevin?
The individual frequencies of the red and the infrared,
Mhm.
we've got it all in this, so we're just gonna do it with this for now. And that's all coming down. Catherine, shake my hand. Oh,
You can
yes.
see it looks better, Greg.
Yes.
Oh, yeah, you
You
can
can
see
see
it from
the
that
grip?
side, but
Squeeze it real hard now.
you need to go by the camera.
Heard
There.
You did good.
Did you get it?
All right, take a break.
Now squeeze my hand. Now you're hurting me. Go ahead, squeeze it hard. It's alright to hurt.
Oh, beautiful.
Isn't that interesting to see?
Yeah.
I love it.
There you
go.
And you know now she'll use it. If Jessica should use it.
Yes, yes, exactly. So there you go, that's rheumatoid arthritis. However, what you need to see systemically, look at the other hand.
Yeah, I know.
You
It's
see
really,
the circulation in the
yeah.
other hand too?
Yeah, it connected.
Yeah. Mhm. It's photons feeding the body. All right.
Feed my body.
Feed me, feed me. That's great.
Yeah.
Okay, one more thing. Wait, we're gonna do the top of your head here. Get that halo going. Yeah. Let's get that. There you go.
That's beautiful.
See that change?
Mm-hmm.
Oh, come back on. There it is. Get that halo going. You don't even want the whole spinal column is just reacting, responding.
So you're waiting for how many breaths? 3?
Well, I'm in the I'm over the sagittal suture,
Mm-hmm.
getting the falx cerebri,
Mm-hmm.
traveling that all the way down the spinal cord. You can see that
Yeah, I
response in
can.
this patient
Yeah,
right
that's
now.
right.
The entire cerebral spinal fluid is flowing and pumping. The sagittal suture is a crucial area to irradiate with laser light, and we don't usually use that term irradiate, but that's a technical thing that you're doing. It's not the same as radiation. And so we're feeding the body photons, we're taking that restriction off of the sagittal suture, we're getting into the falx cerebri, impacting profoundly circulation of the entire brain, and cerebral spinal fluid flow, pumping.
And creating joy.
And creating joy. You're
I
feeling
can
wonderful,
feel it.
isn't it great?
Ah.
So you know, David likes to talk about
You mentioned that
this.
earlier, yeah.
Yeah, and that was involuntary, that smile.
Yeah, see that?
Stop it, you're affecting everybody.
That's great, thank you.
It is. That's beautiful.
And how does it, pain-wise?
What pain?
Pain, she said. Oh,
No,
it's amazing. how-
Significantly improved. Yeah. It's a sort of little ache, but you wouldn't classify it as pain.
Wow, that's pretty good. Let me just do a retest here. Put your fingers out, push out as I push in. Push, stronger, push, stronger. Press your fingers together, honey. Hold.
Wow.
Beautiful.
This one here, little finger. Hold. I can't pull it apart, girl.
You
No.
don't know. We didn't practice that much.
And I didn't pay her either.
I got a bottle of water. It had to be fixed.
It's Dizante water, that's what I said.
We had to fix it. It wasn't even good water.
That's exactly, I get
We had to
paid.
fix it with the laser before you could drink it. Oh dear, that was great. Oh, thank you. Thank you very much. All right, that's good. Well, thank you, everybody. I appreciate this.
Thank you very much.
This is
Great.
I'm gonna do that as best I can. Well, let's just to try to pull a few pieces together, and the basic thing that we need to think about for closure, having followed cases both in the class and now cases in the in a more clinical setting. I think the most important thing that we're seeing with laser therapy is that what I have said and what I've said in the literature that I sent out to the doctors, how I refer to laser therapy, is healing with the speed of light. And it's true. I mean, literally it's true, and figuratively it's true, because you can see changes that would take so long to do with physical therapy, and so long to do with chiropractic, so long to do with other modalities. That the changes are done that fast, it's done quickly, it's done non-invasively. None of the people complained of having significant pain following any of the procedures that we did, even when we were having to mobilize joints that would have been painful for moving. And so I think that with laser therapy, the rest of the story is really about we're on a new frontier here. We have to really think differently. We have to seriously think as quantum medical doctors or quantum chiropractors or quantum massage therapists now. And we have to entertain a whole new realm of possibilities. And out of that realm of possibilities, we've got to start making clinical decisions. But bottom line is, almost any situation is appropriate for laser therapy. Even when you're addressing cancer patients, which we didn't have any cancer patients come today, but when you're addressing cancer patients, I think that you're safe to work with them to take the side effects of the chemotherapy away. It'll help profoundly with the detoxification. And really the only parameter in that situation would be, I wouldn't recommend directly irradiating, laser treating the cancer area. Aside from that, I don't know. It's just limitless, the potential of healing with this. And it's low-level laser therapy. It's not laser therapy as a surgical tool. It's not laser therapy as a real high, high-powered instrument. It's the low-level laser therapy that makes the profound clinical changes for wellness programs, for chronic illnesses that they're not able to touch with the prescription drugs. And that's what we have to protect. We have to make sure that people understand that low-level laser therapy is an entity in its own right. And there's not a lot of money. It's not a lucrative thing in terms of the returns that people see financially for it as an industry. So one of the things that slowed that up is because we don't have a whole lot of money influxing into the development of it. So I, as a clinician, after 20 years, I'm grateful to see what some of these companies have been doing on their own, with not government funding and all that stuff. A lot of the research that we now have access to has been because they've said, hey, this is a good idea, let's develop it. And now they're saying, okay, let's get it so that it's affordable into the clinician's hands. And so we're going to see a wonderful revolution in healing because of all of this. So I don't know, all I can say is I'm very thankful that things that laser therapy has brought into my life for my personal healing, that of my sons, and to see the changes that as a doctor, it's made me so much better doctor than I was when I first, 20 years ago when I first got my little laser in my hands. It's like, oh, what can I do with this? Well, nobody was there saying, do it this way. And it took a lot of figuring it out. Now I'm hoping that what we'll see is greater communication on an international level with the clinicians here, because as I've been sharing with you, unfortunately we don't see a lot of clinicians attending these seminars on laser therapy because the predominantly are addressing the physics and the molecular research and asking questions from that end. I'm hoping that as more clinicians get their hands on it, more people will say, well, wow, why is this happening? Wow, why am I seeing this? And then we'll come together really as a force and start impacting the healthcare system so that reimbursement comes about better and things can happen and be more available financially and otherwise for our patients. And that's the end of the seminar. Thank you.